Most people who have heard of hantavirus assume it is something that happens to other people, to hikers in remote wilderness areas, to researchers working in exotic locations, to people who somehow ended up in the wrong place at the wrong time in the American Southwest in 1993. What almost nobody is telling you, and what makes this conversation genuinely urgent for every adult over 60 watching this video, is that hantavirus exposure happens in ordinary places, to ordinary people, during ordinary activities. It happens in garages, in storage sheds, in vacation cabins that were closed for the winter, in attics being cleaned out for a grandchild's visit, in barns and basements and woodpiles. It happens within a few miles of where you live right now, in all 50 states, in every season of the year. And for adults over 60, the biological consequences of exposure are categorically more severe than for younger adults, for reasons that your physician has almost certainly never explained to you. I'm Dr. William Lee, and today we are going to talk about Hantavirus Pulmonary Syndrome, what it is, what it does inside the human body, why it is uniquely dangerous for aging immune systems, and most importantly, the specific evidence-based prevention steps that dramatically reduce your risk of ever encountering this virus in the first place. This is not a video designed to frighten you. It is a video designed to give you the accurate, complete information that allows you to protect yourself and the people you love. According to data from the Centers for Disease Control and Prevention, Hantavirus Pulmonary Syndrome carries a case fatality rate of approximately 36%, meaning more than 1 in 3 people who develop the full syndrome die from it. There is no specific antiviral treatment. There is no vaccine. The primary care physicians most likely to be consulted during its early stages frequently misidentify it as influenza or pneumonia until the disease has progressed to a point where intervention is critically difficult. A study published in Clinical Infectious Diseases found that the median time from symptom onset to correct diagnosis was 4 to 6 days, and in a disease that can progress from mild respiratory symptoms to complete respiratory failure in 24 to 48 hours, that diagnostic delay is often fatal. Before I get to the most surprising and most frequently overlooked exposure risk on today's countdown, and I want to tell you right now that it is something most people over 60 do at least once a year, often in the spring, that carries a higher hantavirus exposure risk than camping or hiking, and that almost no public health communication has ever adequately addressed. I want to hear from you. Leave a comment below telling me your age and whether you live in a rural, suburban, or urban environment. I read every single comment on this channel, and understanding where you live helps me bring you the most relevant protective information. Now, we are going to count down 6 critical things every adult over 60 needs to understand about hantavirus pulmonary syndrome, from the foundational biology to the specific prevention steps that could save your life. At number 6, and this is where we build the biological foundation that makes everything else on this countdown make sense. What hantavirus actually is, how it enters the human body, and why the specific mechanism of infection makes it so difficult to protect against without deliberate, informed action. Hantaviruses are a family of RNA viruses whose genetic material is carried as ribonucleic acid rather than DNA that naturally inhabit certain rodent species without causing disease in those animals. The deer mouse, Peromyscus maniculatus, is the primary reservoir for Synnombre virus, the strain responsible for the majority of hantavirus pulmonary syndrome cases in North America. Think of the deer mouse as a living viral storage vessel. It carries the virus throughout its life, shedding it continuously in its urine, feces, and saliva, completely without symptoms, completely unaware that it is distributing a pathogen capable of killing a human adult within days of exposure. The critical and counterintuitive transmission mechanism is aerosolization. You do not contract hantavirus by touching a mouse, by being bitten by a mouse, or even by touching rodent droppings directly with your skin. You contract it by breathing. When dried rodent droppings, urine residue, or nesting material is disturbed by sweeping, by vacuuming, by moving boxes, by disturbing insulation, microscopic viral particles become suspended in the air as an aerosol. Think of it like disturbing a bowl of fine powder. You cannot see the particles rise, but they fill the air around you immediately. You breathe those particles in. The virus reaches your respiratory tract, enters the cells lining your airways and lungs, and begins replicating before your immune system has any awareness that an invasion is underway. The incubation period, the time between exposure and the appearance of symptoms, ranges from 1 to 8 weeks, with an average of 2 to 4 weeks. This prolonged and variable incubation window is one of the features that makes hantavirus diagnostically treacherous. By the time symptoms appear, the exposure event may be a month in the past and completely outside the patient's frame of reference for what might be causing their illness. A person who cleaned out a storage cabin in early April may not become symptomatic until May, at which point neither the patient nor the physician typically connects the current respiratory illness to that spring cleaning project. After the age of 65, two specific age-related biological changes increase hantavirus severity. First, the innate immune response. The immediate, non-specific defensive reaction that represents your body's first line of defense against any novel pathogen slows by approximately 30 to 40% in its detection and initial response speed, allowing the virus to achieve a substantially higher replication load before immune defenses are mobilized. Second, the vascular endothelium, the thin cellular lining of your blood vessels, which is the primary target tissue that hantavirus attacks, becomes progressively more fragile and permeable with age due to decades of cumulative oxidative stress and reduced endothelial cell renewal. Hantavirus damages blood vessels by triggering an immune overreaction, a cytokine storm that causes massive fluid leakage from blood vessels into the lungs. In younger adults with robust endothelial integrity, this damage, while severe, encounters some structural resistance. In adults over 65, whose endothelial cells are already compromised by decades of aging, the same immune overreaction can cause catastrophic fluid accumulation in the lungs with terrifying speed. Understanding this mechanism is not intended to frighten you. It is intended to establish with absolute clarity why the prevention steps that follow are not optional precautions. For older adults, they are essential protections for a biological reality that makes your age group disproportionately vulnerable to a disease with a 36% mortality rate. Number 5 on our countdown, and this is the exposure scenario that public health communication has almost completely failed to adequately communicate to older adults. The specific high-risk activities that create the greatest hantavirus aerosol exposure, ranked by their actual documented association with confirmed cases, because knowing where the risk actually concentrates is the first step to avoiding it. The CDC's case surveillance data, analyzed across all confirmed Hantavirus Pulmonary Syndrome cases from 1993 through the present, identifies several activity categories with disproportionate case association. Cleaning or disturbing enclosed spaces that have experienced rodent activity, including sheds, cabins, barns, garages, and storage units, accounts for the majority of confirmed exposure events. The specific danger of enclosed spaces is that aerosolized viral particles cannot disperse and dilute as they would in open air. In an enclosed shed or cabin, a single disturbed nest or dried dropping deposit can raise aerosol concentrations to infectious levels within seconds and maintain those concentrations for minutes to hours, depending on ventilation. The springtime cabin or vacation home opening is the highest risk single event in the annual calendar of many adults over 60, and it receives almost no specific public health messaging compared to hiking or camping in endemic areas. A cabin that has been closed and unheated through winter provides exactly the conditions deer mice require for winter sheltering: warmth from insulation, food from any stored goods, and complete protection from predators. A closed cabin that has hosted even one family of deer mice through a single winter can contain thousands of droppings, multiple nesting sites and insulation or stored materials, and urine deposits on virtually every horizontal surface. Opening that cabin, unlocking the door, raising the windows, carrying in supplies while the disturbed interior aerosol disperses can represent 15 to 30 minutes of concentrated hantavirus aerosol exposure for a person taking no protective precautions. Agricultural work moving hay bales, working in grain storage facilities, cleaning animal housing represents the second major exposure category, particularly in rural western states. Yard work involving ground disturbance in areas with established rodent populations, including woodpile management, compost turning, and working in overgrown areas, represents a third category that is almost entirely absent from public awareness, despite being documented in multiple confirmed case investigations. My patient Robert, 68, from Flagstaff, Arizona, was a retired engineer who opened his family's mountain cabin every May for over 30 years without incident. He swept the floors, aired the bedding, moved the stored items, the routine of a capable, careful man who had performed the same tasks dozens of times. The spring he came to me had been an unusually high rodent population year in northern Arizona, a well-documented ecological phenomenon associated with increased Hantavirus Pulmonary Syndrome incidence. Robert survived his illness. He was diagnosed correctly within 3 days because his infectious disease physician had been briefed on elevated regional hantavirus activity, but spent 9 days in intensive care, including 4 on supplemental oxygen, and told me afterward that the 2 weeks before his diagnosis, believing he simply had a bad flu, were the most frightening of his life. I had no idea, he told me quietly. I just had no idea that opening a cabin could do this. The practical protection framework for high-risk activities. Before entering any enclosed space that may have experienced rodent activity, ventilate it by opening windows and doors and waiting at least 30 minutes for air exchange before entering. Always wear a properly fitted N95 respirator, not a surgical mask, which does not filter particles at the size of aerosolized hantavirus before entering and throughout any cleaning activity. Dampen potentially contaminated surfaces with a disinfectant solution, 1 part bleach to 10 parts water before sweeping or moving material, as wet material cannot become airborne aerosol. Never use a dry broom, vacuum cleaner, or compressed air in a potentially contaminated space. The synergy principle here: combine respiratory protection with nitrile gloves and disposable clothing covering, because while skin contact is not a primary transmission route, handling contaminated material with unprotected hands and subsequently touching your face creates a secondary exposure pathway that occurs naturally during any cleaning activity. Number 4, and this is where we transition from exposure risk to biological recognition, the symptom progression of Hantavirus Pulmonary Syndrome explained in the precise sequential detail that could allow you or a family member to recognize this disease during its brief early window when supportive intervention is most effective. Because the symptom pattern of hantavirus is distinctive enough when you know what to look for to differentiate it from influenza before the critical pulmonary phase begins. Hantavirus pulmonary syndrome progresses through 2 clinically distinct phases, and the transition between them can occur with terrifying rapidity. The first phase, called the prodromal phase, meaning the preliminary warning period typically lasts 3 to 5 days and is characterized by symptoms so similar to influenza that even experienced clinicians frequently do not consider hantavirus in their differential diagnosis. Fever, often reaching 101 to 104 degrees Fahrenheit, develops abruptly. Muscle aches, particularly in the large muscle groups of the thighs, hips, and back, are typically severe and out of proportion to what most patients experience with ordinary influenza. Fatigue is profound and sudden. Headache is common. Gastrointestinal symptoms, including nausea, vomiting, abdominal pain, and diarrhea, occur in approximately half of cases, a feature that helps distinguish hantavirus from influenza, which rarely causes significant gastrointestinal involvement, but that often leads to premature reassurance that the illness is a stomach virus rather than a viral respiratory emergency. The feature most distinctively absent in the hantavirus prodrome, and the one that most reliably differentiates it from influenza during this early window, is upper respiratory symptoms. Influenza typically causes sore throat, runny nose, and upper respiratory congestion. Hantavirus pulmonary syndrome, despite ultimately destroying pulmonary function, causes almost no upper respiratory symptoms during its prodromal phase. If you or a family member develops sudden high fever, severe muscle aches, profound fatigue, and possibly gastrointestinal symptoms, but no significant sore throat, runny nose, or nasal congestion. And this occurs within 1 to 8 weeks of any activity that could have involved rodent exposure. That specific symptom pattern should prompt immediate medical evaluation with explicit disclosure of the potential exposure. The cardiopulmonary phase, which follows the prodrome with little warning, typically begins with a dry cough and shortness of breath that progress within hours to severe respiratory distress as fluid floods the lung tissue. The speed of this progression is one of the most medically alarming features of the disease. A patient who has a dry cough at 8 in the morning can require mechanical ventilation by that same evening. Research from the University of New Mexico Health Sciences Center, which has treated more hantavirus cases than any other institution in the United States, documented cases progressing from first respiratory symptom to respiratory failure in as few as 4 hours in severely affected patients. For adults over 65, the cytokine storm that drives the cardiopulmonary phase is amplified by a phenomenon called inflammaging the chronic low-grade inflammatory baseline that characterizes aging immune systems. Think of inflammaging as a forest that is already dry and partially burning when a lightning strike hantavirus hits. The fire that results is disproportionately large compared to what the same lightning strike would produce in a wet forest. The chronic inflammatory environment of the aging immune system creates the conditions for a more severe and more rapidly progressing cytokine storm in older adults, which is a primary mechanism behind the higher case severity observed in this age group. The practical recognition guidance. If you or someone in your household develops the prodromal symptom pattern described above within 8 weeks of any potential rodent exposure, go to an emergency department, not an urgent care clinic, not a telephone triage line, and explicitly state that you are concerned about possible hantavirus exposure and when and where it may have occurred. This explicit disclosure is critical because it triggers a different diagnostic pathway than a standard influenza evaluation and is the single most important action available to a patient during the prodromal window. For synergy with early recognition, keep a written or digital record of any rodent exposure activities, cabin cleanings, shed work, yard work in high-risk areas with dates, so that if symptoms develop weeks later, you and your treating physician have an accurate exposure timeline to reference. Right here. Before we reach the top 3 items on this countdown, which include the specific home protection strategies that reduce indoor rodent exposure risk, the immune-supporting nutritional and lifestyle measures that are particularly important for adults over 60 in endemic areas, and the single most important public health action that older adults can take to protect their households, I want to take a moment and ask you to subscribe to this channel and hit the like button. The information in the top 3 sections of today's video is where prevention becomes genuinely actionable. And helping more adults over 60 access this content is something your support directly enables. Now, the top 3. Number 3, and this is the section that most online content about hantavirus completely skips because it focuses on wilderness exposure rather than the domestic rodent management that is most directly relevant to older adults living in homes in endemic areas. The evidence-based home rodent exclusion and environmental management protocol that represents the most effective single category of hantavirus prevention for the vast majority of adults over 60 who will never go hiking in the wilderness, but who share their regional environment with deer mouse populations that come indoors seeking warmth, food, and shelter every autumn. Deer mice are not exclusively wilderness animals. They inhabit suburban and rural residential environments throughout the western United States and increasingly in other regions. And they enter homes through gaps and openings that most homeowners have never identified or sealed. A deer mouse can enter a structure through a gap as small as a 1/4 inch, approximately the diameter of a pencil. Common entry points include gaps where utility pipes and cables enter the foundation, spaces between the foundation and the sill plate of the wall frame, deteriorating weather stripping under exterior doors, gaps in the seals around dryer vents and HVAC penetrations, and openings in the eaves and roofline where the structure meets the roofing material. Research from the CDC's National Center for Infectious Diseases found that thorough exclusion sealing of residential entry points reduced interior rodent activity by approximately 70 to 80% in homes in endemic areas, representing by far the most effective single preventive intervention available to homeowners. For adults over 60 who may own homes with aging infrastructure, older weather stripping, foundation cracks that have developed over decades, deteriorating seals around utility penetrations, the exclusion audit is particularly urgent and particularly likely to reveal actionable vulnerabilities. The audit should be conducted from the outside, systematically examining the perimeter of the foundation, every utility penetration, every door and window frame, every point where dissimilar materials meet. Any gap larger than a quarter inch should be sealed with steel wool packed firmly into the opening. Mice cannot chew through steel wool, followed by caulk or expandable foam to secure the steel wool in place and provide a weather seal. Indoor rodent detection is equally important. Signs of deer mouse activity include droppings, which are approximately 1/4 inch long with pointed ends distinctively different from the blunter droppings of house mice shredded nesting material in undisturbed areas such as the backs of closets or drawers, and gnaw marks on food packaging or structural materials. The critical prevention behavior when evidence of rodent activity is discovered indoors is to resist the impulse to immediately clean it up, which is precisely the behavior that creates the aerosol exposure risk. Instead, apply the bleach solution, allow surfaces to wet thoroughly, leave for 10 minutes, then wipe with disposable towels wearing gloves and an N95 respirator, and seal all materials in a plastic bag for disposal. My patient, Margaret, 71, from Albuquerque, New Mexico, discovered deer mouse droppings in her kitchen cabinet while reorganizing her stored cookware in March, a seasonal activity that coincides with the period when deer mice that overwinter in residential structures become more active as temperatures fluctuate. Margaret's instinct was to grab a broom and sweep the cabinet out immediately. She called my office first, having recently watched an educational video about hantavirus risk in New Mexico, and I was able to walk her through the correct cleaning protocol, the bleach solution, the waiting period, the N95 respirator, the sealed disposal. Margaret was frustrated by the complexity of what had seemed like a simple cleaning task, but she completed the protocol correctly. Her subsequent home inspection identified 3 entry points in her foundation and a deteriorated door sweep on her back door that we had sealed by the following week. She has had no further rodent evidence in her home in the 2 years since. For practical home protection, conduct a complete exterior exclusion audit annually, ideally in late summer or early fall, before cooling temperatures drive rodents to seek indoor shelter. Store all food, including pet food, in sealed hard-sided containers rather than paper or cardboard bags that rodents can penetrate. Remove clutter from storage areas, as cluttered spaces provide ideal nesting cover and make rodent activity difficult to detect. Keep firewood stacked away from the house exterior. For synergy with structural exclusion, outdoor rodent population management using snap traps, not poison baits, which can create secondary poisoning risks for wildlife and pets around the perimeter of the home, reduces the source population that is attempting entry, compounding the protective effect of exclusion sealing. Number 2, and this is the conversation that I wish every physician in endemic areas was having explicitly with their patients over 60. The specific immune supporting measures that reduce the severity of hantavirus disease if exposure and infection occur despite all prevention efforts. Because in a disease with no specific treatment, the strength and balance of your immune response is the primary determinant of whether you survive and recover. I want to be absolutely clear about the framing here. These measures do not prevent hantavirus infection. The only prevention is avoiding exposure. What these measures address is the biological resilience of the immune system that must respond to the infection if it occurs, and for adults over 60 whose immune systems have experienced the age-related decline called immunosenescence that I described earlier, actively supporting immune function is not a wellness preference, but a measurable risk reduction strategy. The two most evidence-supported immune-supporting interventions for respiratory viral diseases in older adults are vitamin D3 optimization and zinc adequacy, both of which are deficient in disproportionate percentages of adults over 65, and both of which have specific documented roles in the immune response pathways most relevant to hantavirus disease severity. Vitamin D3 functions as an immune system modulator. Think of it as the thermostat for your immune response, preventing both insufficient reaction, which allows viral replication, and excessive reaction, which creates the cytokine storm responsible for hantavirus-associated lung destruction. A meta-analysis from Queen Mary University of London, published in the BMJ, found that vitamin D supplementation in adults over 65 reduced the risk of acute respiratory infection by 42% in those who were deficient at baseline. More specifically relevant to hantavirus, research from the University of California, San Diego found that adequate vitamin D3 levels measurably reduced the production of the pro-inflammatory cytokines, interleukin-6 and tumor necrosis factor alpha, most directly implicated in hantavirus-associated cytokine storm, suggesting that vitamin D3 sufficiency may reduce the severity of the immunopathological tissue destruction even when infection occurs. Zinc is a direct cofactor for the function of natural killer cells and cytotoxic T lymphocytes, the immune cells responsible for identifying and eliminating virus-infected cells before viral replication becomes systemic. After 65, zinc deficiency present in an estimated 35 to 40% of older adults due to reduced dietary intake and impaired intestinal absorption, reduces natural killer cell activity by approximately 30%, directly impairing the early viral containment response that determines how rapidly hantavirus can replicate during the prodromal phase. Research from Wayne State University found that zinc supplementation in zinc-deficient adults over 65 restored natural killer cell function to levels comparable to younger adults within 8 weeks of supplementation. The practical immune support protocol for adults over 60 in hantavirus endemic areas. Have your vitamin D3 blood level checked, a simple and inexpensive blood test, and supplement to achieve a serum level of 40 to 60 nanograms per milliliter, which typically requires 2,000 to 4,000 IU of vitamin D3 daily for most deficient adults over 65, taken with a meal containing fat for optimal absorption. Ensure dietary zinc adequacy through foods including pumpkin seeds, oysters, and lean red meat, or supplement with 15 to 25 milligrams of zinc. Daily zinc glycinate or zinc picolinate forms are best absorbed in the aging gut. For synergy, take vitamin D3 alongside vitamin K2, which directs calcium mobilized by vitamin D into bone rather than soft tissue, and alongside magnesium glycinate, which is a required cofactor for vitamin D activation in the liver and kidneys and is deficient in an estimated 48% of older adults. All scientific references are in the description below. And now, number 1, the most powerful, most accessible, and most consistently underemphasized protective action available to adults over 60 in hantavirus endemic regions. The deliberate, systematic, and correctly executed seasonal preparation protocol for enclosed spaces performed before the high-risk spring and summer activity season begins that eliminates or dramatically reduces the aerosolization hazard in the spaces most likely to cause exposure. The reason this sits at number 1 is that every other prevention strategy exclusion, rodent population management, N95 respirator use during cleaning, is reactive. It responds to rodent activity that has already occurred, exposure risk that is already present, or infection that has already begun. The seasonal preparation protocol is proactive. It eliminates the conditions that create concentrated exposure risk before the human activity that would trigger exposure takes place. The protocol has 5 components, each of which addresses a specific link in the chain between rodent habitation and human aerosol exposure. The first is preseason ventilation. Any enclosed structure that has been closed for an extended period, a cabin, shed, garage, storage unit, should be ventilated by opening all available openings and allowing at least 30 minutes of air exchange before any human entry, ideally on a day with moderate wind to accelerate dilution of any accumulated aerosol. This single step alone, performed before the initial entry that most